Support comes from Missouri Forest Products Association, committed to sustainable and sound conservation of the state's forests, which support more than 41,000 Missouri jobs, resulting in a $10 billion industry. ChooseWood.com.
From St. Louis Public Radio. This is St. Louis on the Air.
So are there plans on a statewide level, perhaps, to try to target these communities that are falling behind and increase their interest in getting these vaccines?
The health experts who I've spoken with say that what's really tricky about a lot of these areas is that they are, people there are not necessarily going to listen to some really high-ranking expert, somebody like Anthony Fauci. Mm-hmm. Instead, the kind of person who they're really going to listen to, there's a term they say, a trusted messenger, somebody who is actually a member of that community who's, willing to tell their neighbors, I've taken this vaccine, it's safe, it worked for me, and it'll do the same thing for you.
I'm Sarah Fenske. On April 9th, Missouri Governor Mike Parson opened up COVID-19 vaccine eligibility to all Missouri residents. Now, 1 in 3 Missouri residents have gotten at least one shot. But in southern Missouri, vaccination rates have stalled at some of the lowest rates in the U.S. That's the subject of a new report by Alex Smith. He's the health reporter at our sister station, KCUR, in Kansas City, and he joins us today. Alex Smith, welcome.
Good morning.
Alex, before we jump into the conversation, we want to express our sincere condolences for the loss of your colleague at KCUR. Reporter Aviva Okeson-Haberman died last week at age 24. And Alex, all of us here are just so sorry for your loss.
Well, thank you. I appreciate that. She was a very, very talented and kind person, and we're definitely missing her a lot this week.
So let's talk about vaccines. 1 in 3 residents being vaccinated. That sounds like a good start. Overall, has Missouri made some strides to catch up to the rest of the country after what was initially a very slow rollout?
Well, the pace has definitely been picking up. I mean, Missouri is still kind of toward the bottom of states in general, but it has been picking up. Although, as you mentioned at the beginning of the segment, the rates are still very, very low in especially a lot of the southern parts of the state. I mean, across a pretty large swath of kind of the central southern Missouri area, we see rates of around 14% or less. There's actually one county in central Missouri, Pulaski County, that has a vaccination rate, a completed vaccination rate of just a little less than 8%.
8%? That does seem exceptionally low. What do we know about what is driving that?
Well, there are a few reasons for these low rates. I mean, generally, polling has shown a lot of doubts about vaccines, particularly among political conservatives and just residents of the region of southern Missouri. I, for the story, spoke with some leaders and some residents of Howell County, which is right along the Arkansas border, and they talked a lot about these attitudes. In fact, a lot of them said even kind of proudly that these sort of anti-establishment attitudes that are really driving a lot of this skepticism are almost kind of part of this Ozark culture, and they have really been amplified during the vaccination push.
Let's actually play one of those clips that you provided to us. This is from your conversation with Autumn Shirley. She's a business owner in Howell County. Now, we want to make clear she is not speaking for herself here. She sought a vaccine when it first became available, but she told you that her community is conservative and in general has deep skepticism of the medical establishment.
It's almost to the point where asking a person to get a vaccination is sort of asking them to change their personal identity in some way. Some of these very conservative people truly believe that this is a government overreach, and at the very least, it's a government overreach, and at the worst, it's also a way to track us or sterilize us or make us all sick. There's just so much.
And that is Autumn Shirley, who lives in Howell County, Missouri, a very low vaccination rate there. We do want to make clear this is not a government effort to track us or sterilize us. But let's talk about that idea of government overreach. Alex, these areas in southern Missouri that haven't been getting vaccinated, are they areas that were not hit hard by COVID-19?
Well, no. In fact, I mean, just the opposite. I mean, these are a lot of parts of the state that were hit very hard. I mean, we know that there were a lot of pockets that sort of popped up, just over the last year, where you just saw these big explosions of these cases, and a lot of these situations did happen in southern Missouri. And kind of interestingly, there's some polling that came out last week that I think we might talk about more later, but it showed that actually a lot of the places that have been hit the hardest are actually kind of just, I don't know, ironically, I guess, also a lot of the places that have the most skepticism about getting vaccinations.
I'm curious your thoughts on that. Is this a cost-benefit analysis? They feel like they've lived through this and it wasn't that big a deal.
Well, I haven't seen really a lot of data on this. I have heard anecdotally that there are a lot of people who, got COVID, were infected with it themselves, and believe, that kind of provides for them some lasting immunity. And, we're not really sure exactly how long immunity lasts. If somebody does have, is just naturally infected and develops natural immunity. And we also know that some of the variants that have cropped up and are now in Missouri, are able to sort of evade the immune system, particularly, evade some of that natural immunity that's created just through natural infection. So, yeah, that's definitely, that sense of security, that somebody might have after they've had it, isn't entirely, founded as well in science as, what we know about the vaccine immunity.
So health officials still want these people to get vaccinated, even if they feel like they've got antibodies.
Absolutely, yeah.
And so are they making a push to get this to happen? I mean, it sounds like there are doses available for these people.
Well, that's right. I mean, just the way that the Missouri vaccine strategy was rolled out, I mean, we know that in the beginning there were a lot of doses, that were allocated to the rural regions. I mean, in southern Missouri, in a lot of this part of the state that I looked at, there were more doses per person allocated than there were in Kansas City, for sure, because they really wanted to rely on those mass vaccination events in places that didn't necessarily have hospitals or a lot of the infrastructure, kind of existing to do that. And so a lot of doses have gone into a lot of these areas, but they have not necessarily gone to the residents. I mean, for my reporting here, I looked and found that, about 2/3 of the doses that were sent to these places that were actually administered to local residents. And it's actually not really quite clear what would happen with the rest of those doses, if those are still kind of on the shelves, if they may have been sent to other places, or, if people from the cities might have gone into those areas to get those vaccines. Like that happened for a lot of people I know in Kansas City and St. Louis.
So these road trips that, yes, a lot of St. Louisans, I can attest, were taking these road trips. This might have been what claimed some of these doses. But at this point, it sounds like there should be a vaccine for people who want one.
Well, right now, we know that the requests for vaccines in a lot of these areas have really declined a lot, which would suggest that, the vaccinators who are in these places don't think that there is a lot of demand, or the demand has really, dried up. I mean, it's just really hard to tell exactly what's going on. I mean, the state data is kind of complete, and, you'll talk to different people who will say that there are people in these communities who are, wanting to get vaccines, but they've just had trouble connecting with the vaccinators. They've had trouble scheduling appointments. It's a little bit hard to parse out, how much of this has to do with access and how much of this has to do with kind of some lingering attitudes and skepticism.
So are there plans on a statewide level, perhaps, to try to target these communities that are falling behind and increase their interest in getting these vaccines?
I've spoken with some state health department leaders who say, they do plan to do some, kind of specific outreach into rural areas, just the same as they have, tried to do in Kansas City and St. Louis. I think the health experts who I've spoken with say what's really tricky about a lot of these areas is that they are, people there are not necessarily going to listen to some really high-ranking expert, somebody like Anthony Fauci. Instead, the kind of person who they're really going to listen to, there's a term they say, a trusted messenger, somebody who is actually a member of that community who's, willing to tell their neighbors, I've taken this vaccine, it's safe, it worked for me, and it'll do the same thing for you. I mean, just the idea that trust within the community is really what you need to build up.
So you referenced earlier the big issue, it seems like about a month ago, was that St. Louis and Kansas City were being left behind in vaccine distribution. There was a sense that deserts were developing in these urban areas. Has that continued to be a problem with where things stand now?
Well, in Kansas City, we have definitely picked up a lot. I think I checked out the St. Louis numbers, and I see that it looks like in St. Louis City, the vaccination rates are lower than the state average. St. Louis County, it looks like it's pretty close to the state average, although not quite there. So, I mean, things have definitely improved a lot in the cities. But, again, kind of going back to the rural situation here, we know that the rates there have really slowed out, or stalled out, especially in the South.
Mm-hmm. So with this stalling out, say that anybody who wants to get one ends up being offered one. The distribution is sort of taken off the table as being a problem. They're able to crack that issue there. Could the state then just say to each his own? What do you see as the downside of a big swath of some of these rural counties opting out?
Well, the health experts who I've spoken with say that probably with the vaccination rate that we're at, we are not going to necessarily get into this situation where there's kind of a large statewide surge. I think that, has been the concern a long time before vaccines were available. Mm-hmm. Instead, probably the bigger concern is that there could be sort of, minor surges that might affect, a community and then, hopefully would be contained. So there's that danger, definitely in these smaller communities. There's also the danger of, this kind of opens the door for more variants forming. When somebody, especially who has, I think they found sort of a compromised immune system and is sick for a long time, then that kind of creates an opportunity for a variant to form. And, kind of the big concern right now is these variants that may potentially evade the immune system or where vaccines may be less effective. So we're really trying to, contain the virus as much as possible and contain the development of variants. But before that happens, and, that will be harder to do when communities, have this kind of lingering low vaccination rate.
So, Alex, there's one last thing I wanted to ask you about today, and that's that Missouri very recently decided to again allow distribution of the Johnson & Johnson vaccine. What do we know about that decision?
That's right. Missouri just very quickly after the federal government issued the guidance, to kind of put the pause on the Johnson & Johnson vaccine due to, some low risk of blood clot. Missouri followed suit in that. And then just as soon as as soon as the federal government lifted that pause, Missouri, did the same thing. The state says that in Missouri, they have administered more than 100,000 doses and have not had a single reported case of any of these blood clots. So the state health department is feeling, very confident about this, very comfortable advising that. I think one issue, though, that, seems to have cropped up, among the health experts that I've spoken with is that pause and just some of the concern about blood clots has possibly slowed enthusiasm for all the vaccines. In Kansas City last week, we had some events that had very, very low turnout. And I think a lot of the fear that they had was that people just thought that, that Johnson & Johnson, very specific concern about the blood clot, was kind of related to all the vaccines. And so that's something that we'll now, I guess, have to try to overcome.
So it sounds like there's some real challenges ahead of public health officials. We maybe thought of the previous months as this was the hard part, getting things going, but now we're dealing with a number of issues here.
It's true.
Well, Alex Smith, health reporter at KCUR, I want to thank you so much for joining us today and sharing all this information.
Thank you, Sarah. Nice talking with you.
St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here. If you learned something new from today's episode, consider leaving us a review and rating on Apple Podcasts on the App Store. It's the easiest way to help people discover our show. We appreciate it. Thank you. St. Louis Public Radio is a member-supported service of the University of Missouri, St. Louis.
Support comes from the Missouri Forest Products Association. Missouri produces wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details on the variety of products made in the state are at choosewood.com.